Belgium, Germany and soon England too. Across Europe, countries are heading back into various degrees of lockdown, all in a bid to try to curb the spread of the second wave of coronavirus. Stricter measures came into force in both Belgium and Germany from today, while residents in England prepare for a 4-week period of confinement. Evelyn Laverick has this report.
A last chance for a coffee or a beer. Germany's joining the list of European countries reimposing lockdowns to try and stem the surge of Covid-19 infections. This one is a partial lockdown, but it's to last 4 weeks. Numerous restrictions include the closing of bars and pubs, while restaurants will remain open for takeaways only.
We just love to be outside and drink coffee. But of course, we also understand that for 1 month, it's okay, because it is the right thing to do.
I certainly understand the measures, but at the same time I can also understand criticism, because if you look at the event industry, cinemas, leisure facilities, where in some cases no infection has been detected, why should they close? It's a bit annoying, of course, also for the restaurants.
German Chancellor Angela Merkel says the move is to avoid an acute national health emergency. Belgium is also shutting up shop, having become one of the hardest hit countries in the European Union. Non-essential retail outlets have been closed, along with trades that require close contact, like hairdressers. The number of people admitted to hospital over the past week was 77% higher than the previous 7 days. France has already begun its second national lockdown, but is having difficulty sorting out the new restrictions. After complaints by smaller so-called non-essential shops that have been forced to close, Prime Minister Jean Castex has told supermarkets to close off their non-essential shelves to keep things fair.
C'est un problème de justice. Eh bien, moi, j'entends ça.
It's a question of justice, and I hear that. I understand that we can consider that we cannot sell such and such a product. Flowers, books in a local store, but we can sell it in supermarkets. I understand that, and it can be shocking.
And even as England prepares to go into lockdown on Thursday, the government has added to the misery, warning it could last beyond an initial December 2nd end date. Evelyn Laverick, Euronews.
Well, to get the latest on the lockdown measures being enforced from today in Belgium, let's head to speak to our correspondent Shona Murray in Brussels. Shona, morning to you. So life changes considerably as of today for all residents. Just talk us through what the new rules are.
Well, Rosie, today is the first day of the intensified lockdown that was announced just a couple of weeks ago. As of today, non-essential retail shops, barbers, hairdressers, beauticians are all going to be closed. Schools will remain closed till the 15th of November. Working from home is compulsory. And we heard at the weekend from the Health Minister that this is really an aid of saving the health system, which is almost being overwhelmed. We've talked about it for the past few weeks, but if you look at the figures, the ICU figures are well over 1,000 people in intensive care. But there's a feeling that if the rates continue to rise, you could have over 2,000 people in ICU. We reported from a hospital in Liège just a few days ago, as we know, Rosie, where nurses who are COVID positive are asked to come to work anyway if they're asymptomatic, so they can tend to those in ICU because the staffing levels are so low. The staffing levels are low because people are sick, but also people are suffering doctors are suffering PTSD from the last part of the pandemic in March and April. So it's quite serious here in Belgium. What's interesting at the weekend, though, was when you look around here in Brussels in the city centre, a lot of people were doing last-minute shopping in the non-essential retail units that are going to be closed from today. And there were huge queues coming outside those shops. They were as busy as they could possibly be, which really is a kind of a contradictory message, you know, from people who hope to abide by the rules, but at the same time are putting themselves in that position. Overall, though, I think there's a consensus that this has to be done to protect the health service and to eventually come out of this situation as proposed by the 13th of December. Rosie?
Shona, thank you very much. The latest there from Brussels. Well, as the so-called lockdown light comes into effect across Germany, our reporter in Berlin, Jonah Kalgren, says despite the no fun, just work restrictions, the majority of Germans support the measures.
kind of suitable, isn't it? On this morning of lockdown, like there's also a downpour of rain adding to that general feeling of misery and depression. Now, here in Germany, you can basically describe the new rules as no fun, just work. You know, people are allowed to work, people are allowed to go to schools, they're going to stay open, kindergartens are going to stay open, and shops are going to stay open, so you could continue to go and buy whatever you want. But everything else, all the fun stuff basically is going to be closed down. Nightclubs, obviously, restaurants, bars, any kind of cultural events, museums, tourism, all of that is essentially banned. So that is basically the situation that we are in the country at the moment. Now, if you look at opinion polls, most Germans agree with these new measures. We've seen a spike in new cases and people are worried and they're saying, yes, we need to do something. But there is dissent within the country as well. Obviously, if you work in an industry that has been hit, most likely the restaurant industry or the hospitality industry, then you might be a lot more negative towards these new rules compared to if you work in an industry that hasn't been hit by these new rules. So in general, people are in agreement, but there is a growing sense of dissent that we didn't have when they introduced the lockdowns in spring.
The UK Prime Minister Boris Johnson will seek to win support for a planned 4-week lockdown across England in a parliamentary statement later today. Mr Johnson announced at a Downing Street news conference that strict measures will mean the closures of pubs, restaurants, gyms and non-essential shops. But growing numbers of senior Conservative backbenchers have signalled their opposition to the measures, which are due to come into effect on Thursday. Restrictions are planned to end on the 2nd of December, but members of the government have indicated that the date is not set in stone. Dr. Jeffrey Lazarus, who's with the Barcelona Institute for Global Health, told me national lockdowns are only one of many different approaches European leaders need to take to get a grip on the spiralling pandemic.
I think they'll help, but they're not enough if we don't put in the tried and tested pandemic control measures that we know we need. We need to ramp up testing, we need to ramp up tracing, in addition to these kinds of lockdown measures.
You know, we're based in France here, and some of the rules are very strict. You're only allowed 1 kilometre from home. You can only go out for 1 hour, and you've got to bring a certificate with you. But my general feeling when I took my 1 hour of exercise over the weekend was that there isn't so much public anxiety and fear. There were more people outside than I thought there would be. How do authorities ensure compliance that this time around people do in fact follow the rules?
Well, the authorities really need to instill trust in the population. The population needs to understand exactly what's happening and why. So one thing I think that needs to happen in France and across all of Europe is a massive educational intervention. We need to go door to door explaining what's happening, handing out pamphlets, engaging with the population so they understand the seriousness of this, and that the authorities are taking the measures that make most sense.
So you think the public health campaigns that are being transmitted to Europeans maybe haven't been as effective as they should have been?
I don't think they've been effective enough. I mean, I'm in Spain right now and I see the same thing. People are outside, people are relaxed, groups larger than 6 are forming. The authorities need to engage and explain, not just fine, but hand out pamphlets, hand out gel, hand out face masks, and explain that if we're going to get out of this mess, we need to all work together.
To what extent are we just looking at a period of lockdown, then lockdown lifting and going back into lockdown until, and we don't even know for sure, that a vaccine arrives?
I mean, it's anyone's guess, but from what I can see, I think we're going to be in this cycle for a while unless we make a big change. It's still difficult to get a test in many places. Tracing is not working well across Europe. We've seen the data from England. We know it from Spain. We need to really, really increase the testing and tracing to get out of this. The lockdown is a period when we can breathe and relax a little bit in terms of finding the energy to ramp up those testing and tracing activities. But if we don't, we're going to keep moving in and out of these cycles.